Hi, my name is Meredith. On the day that the eggs are retrieved, they are fertilized with the sperm. This can be done one of two ways. In one method, the sperm and the egg are put together in a dish and a single sperm will enter the egg. This is referred to as IVF or in vitro fertilization. In the second method, a single sperm is selected and injected directly into the egg. This is referred to as ICSI or intracytoplasmic sperm injection. A fertilized egg is referred to as an embryo. The embryos are then allowed to develop in the embryology lab. On the third day of development, the most ideal embryo has approximately 8 cells, and by the 5th or 6th day of development, the embryo should reach the blastocyst stage, at which point it has approximately 200 cells. On the third day of development, your doctor may recommend that the embryos undergo assisted hatching. With assisted hatching, a small defect is placed in the shell surrounding the embryo to allow for the embryo to escape from that shell by the 5th day of development. There is a natural attrition process that will occur throughout this development of the embryos. Not all of the eggs will be fertilized, and of the ones that are fertilized, not all of them will make it to the blastocyst stage. Of the embryos that do reach the blastocyst stage, these can be genetically tested if you choose. With the genetic testing, several cells are removed from the embryo. They're removed from the cells that are destined to become the placenta. These cells are called trophectoderm. Those cells are then sent for genetic testing to assess if that embryo has the correct number of chromosomes. The two main methods of genetic testing are array CGH and next-generation sequencing. Typically, preimplantation genetic screening, or this genetic testing, is used to help aid in embryo selection. This is an example of an embryo that has the correct number of chromosomes. Genetic testing will also reveal the gender of that embryo. This is an example of an embryo that does not have the correct number of chromosomes. Here, this embryo is missing a chromosome 10 and has an extra chromosome 16. This is an embryo that would not be transferred.